one of the things that I like to do in my practice is, be an early adopter of some of the, different orthobiologic treatments for joint disease. And, you know, as I have found, there can be an appropriate use and there's an appropriate time to try these. And it definitely is a patient by patient basis. And it depends on, where the patient is as far as not only the chronicity and severity of the joint disease, but also what they have tried and how compliant they are with some of the other multimodal approaches, right? Which goes into that kind of multidisciplinary care team. Stem cell in general is a bit of a misnomer, because even stem cell injections out there have had and have been proven to have very low populations of stem cells. If anything, it's a growth factor injection, and there are multiple variants of that. The most common being PRP, or platelet rich plasma, which is derived from your blood, and that uses the growth factors and platelets within your blood to, in a sense, change the inflammatory environment or the environment of the knee or the shoulder or whatnot. And so there can be a role and it can be effective, and the research is growing, although it's most certainly not of volume yet. Nima, what are your thoughts on it?
I totally agree with you. In orthopedics right now, we've had a lot more randomized control trials coming out on PRP, which you mentioned. Stem cells, not as much. I mean, we have both, but PRP has a lot more evidence. And there's been success against placebo and cortisone injection, as well as hyaluronic acid, which you may hear is like the rooster injection, some patients will call it. It's a lubrication. There's been studies on PRP versus all those in the knee, and PRP for mild to moderate arthritis has been shown to be successful at 1 year and more successful than those. And it's also been very helpful for tennis elbow. So when we think about lateral epicondylitis, we've found that PRP injections are very helpful. What I tell patients when it comes to PRP is, if you've tried other things, if you can afford it, we know it's not going to harm you. There is a good it could be a good option for people with knee or shoulder arthritis that's mild to moderate. It could be a good option for people who have tennis elbow or partial tendon tears, because we can increase blood flow. That's how I think of it in my head.
Yeah, and I think that's a great way to kind of break it down. And I think in the ultimate situation, in the ultimate environment, is there's collaboration between someone like myself, who is specialized in more non-surgical approaches, and a surgeon, because then it's saying, listen, this person is more in the severe or has more of a severe tear. I think you need to go see Dr. Moran and see if there's maybe a more intense approach or a stronger intervention that might be more applicable in this situation.